And what is chiropractics? Well, it was a practice that was developed by a gentleman named D.D. Palmer on September 18th, 1895. It's not a science. He's not a scientist. As a matter of fact, Daniel David Palmer was an alchemist and a magnetic healer. And chiropractics arose from a single anecdote about a gentleman whose deafness was healed by a chiropractic adjustment. Palmer thought that a bone was out of place in a deaf janitor's back. He adjusted this bone, supposedly, and reported that the janitor was no longer deaf. The thing is that the janitor's daughter said her father was deaf until he died, and no one else has ever been cured of deafness by chiropractic adjustments. And the other thing is that the nerves to the ear are all in the skull. They have no connection to the spine, so any adjustment to the spine shouldn't have any effect on what's going on with the ear. Chiropractics explains all diseases through what they call vertebral subluxations. This idea has never been tested. Again, like with homeopathy, let's think about the state of medicine at the time that D.D. Palmer started practicing. Conventional medicine or conventional medical treatment was just as likely to harm as it was to heal. Germ theory was not widely accepted. The first antibiotic was not discovered for another 50 years. And in 1895, X-rays were discovered and weren't widely in use. So there really wasn't any way to ever verify that any bones were out of place. And remember, it's the bones that were being adjusted as part of chiropractics. After D.D. Palmer, his son Bartlett continued the practice, and this person was totally opposed to vaccinations and rejected germ theory even as it came into wider acceptance. There are three parts to chiropractic theory. One is subluxation, which refers to, in this case, the displacement of bones in the spine, and that this displacement is the root cause of all disease. Keep in mind the different practices that we've talked about in this topic and what the different root causes are. For example, acupuncture believes that an imbalance in the yin and yang and influence the flow of energy along these meridians in the body. In chiropractics, it's the displacement of bones that are the root of cause of all diseases. Also, the theory states that all body functions are governed by nerves from the spine, and that subluxations impair nerve function. Finally, that there is this mystic, vitalistic force that restores health through nerves when the spine is properly aligned. And vitalism is the belief that all living beings have this invisible life force that's not found in inanimate objects. It's this innate vital force, not like the innate immune response that we've talked about, rather an innate, invisible, vital force that gets restored when the spine is properly aligned. I have to tell you, there are real subluxations and dislocations. They're just not the kind that chiropractors talk about. There are orthopedic subluxations. It's a medical term for a painful partial dislocation, and it can be seen on an X-ray. I think you can see the painful partial dislocation on this X-ray. Orthopedic subluxations have never been associated with any organic disease, and they're commonly caused by disc degenerations, curvature of the spine, or structural abnormalities. Chiropractic subluxations, on the other hand, have never been located on an X-ray. These subluxations are alleged to cause disease by interfering with nerve supply to the organs, but there's no credible evidence to support the contention that nerve interference originating in a single spinal segment can cause an organic disease. So what's that cracking sound you hear when you get adjusted? Well, it's kind of like cracking your knuckles. When you pull your finger bones apart, the ligaments stretch and the pressure inside the fluid reduces. This makes room for a tiny little bubble to form, and this tiny bubble makes a big cracking sound. This is where I can answer the question, no, cracking your knuckles is not going to cause arthritis. It just causes a cracking sound. Chiropractors say that pressure on the nerve impedes the flow of messages through that nerve. And if nerves are so easy to pinch, then why aren't these ladies really sick? I mean, look at those positions. Surely they're pinching some kind of nerve. But does chiropractic work? For back pain, yes. But there's no data to show that it works any better than physical therapy. For non-musculoskeletal problems, no, or at least no better than placebo. Now, I want to talk to you about vertebral arteries and neck cracking. You want to see a chiropractor for your lower back. I don't have a problem with that, and I'll give you some recommendations I saw on Dr. Hall's videos. But when it comes to the neck, that's when I get scared. This is what the normal position of your vertebral artery looks like, going up through your spine into your skull. When your neck gets adjusted, it gets twisted during a neck manipulation. This can be very dangerous. This may lead to a rupture in the artery. No, there's not statistically significant data, but I have to tell you, when I hear of a young person suffering from a stroke shortly after having a neck adjustment, I have to wonder. Now, please, you should be saying, but correlation doesn't prove causation. And you're absolutely right. The fact of the matter is there is a prior probability, there is a mechanism by which this can occur, and there's no reason to get your neck adjusted. If there was data to show that neck adjustments proved that the benefit outweighed the risk, that would be one thing. But there's no data to support that, and there is a risk. Please don't get your neck adjusted. And what about spinal cord injuries? Spinal cord injuries are more than just an impinged spinal nerve. And if there's this innate intelligence in the body, well, look at these folks. Their organs are continuing to work. And if the subluxation theory were correct, these folks would be ravaged by all sorts of unimaginable, well, I have here imaginable, ravaged by all imaginable illnesses. If you want to see a chiropractor, what I ask you to do is please consider the following. Please find one that rejects the subluxation theory. There is no evidence for chiropractic subluxations. So much for formatting. Please avoid chiropractors that believe in vitalism, in that invisible magical force. Please don't see a chiropractor who needs to take a full set of spinal x-rays or wants to do unproven procedures or tests. Please don't go to one for just preventative or maintenance adjustments. What you need to do is set up a plan with a chiropractor in which, if you don't feel better within 6 weeks or a certain set of time, you will stop seeing your chiropractor and look for another reason for your back pain. Please don't go to a chiropractor that wants to do maintenance adjustments. I have a friend who goes to see a chiropractor once a month. I said, "What for?" She said, "I don't know. But I want her to be my friend, so I try to keep my mouth shut." Please don't go to a chiropractor that tries to sell you dietary supplements or pretends to be a family doctor. Don't go to a chiropractor that treats young children or one that discourages immunizations. Please find a chiropractor that supports scientific medicine, that will limit their practice to musculoskeletal problems and will make referrals when appropriate. These would be the conditions for a safe chiropractor. So please, I ask you, be safe. And last but absolutely not least, herbal medicine. Natural means safe, right? Not right. This plant is called the Aristolochia plant. I'm just reading you what was in, of course, WebMD, but it is a plant that has been used to treat seizures. Well, actually, it says here to prevent seizures, despite serious safety concerns. It's been used to prevent seizures, increase sexual desire. You can read as well as I can speak, so you can have a look at it. What I like the most, how does it work? There isn't enough information to know how it works. So what you need to know is that it is unsafe. It contains something called aristolochic acid, which is toxic to the kidney and can cause cancer. It can damage the kidneys, leading to the need for dialysis and transplant. And it greatly increases the risk of bladder cancer and other urinary tract cancers. Just because something is natural doesn't mean it's safe. Here are some examples of natural things that aren't necessarily safe. Poisonous mushrooms, they're natural. Botulinum toxin, also known as Botox. Angry bears are natural. Cocaine is natural. That doesn't mean it's safe. Herbs are unpurified drugs. If you looked at the breakdown or looked at what was in an herbal product, well, this little cartoon here says chemical, medicinal chemical, bunch of other chemicals, more medicinal chemicals. The things about medications or drugs is that they have purified the medicinal component found in the plant or the herb, and you know what you're getting, and it's been tested. When you take an herbal product, you don't know how much of the drug is in it, and that can be dangerous. What I'm about to show you is what I call nature's pharmacy, though. We get lots of medications from plants. We got aspirin from the willow bark. Digitalis, that's used for heart failure, came from the foxglove plant. Quinine for malaria came from the cinchona plant. Taxol, an important medication that's used in the treatment of ovarian cancer, has been isolated from the Pacific yew. And goat's rue, or something called French lilac, well, from that plant, they isolated the chemicals that are used to make metformin, that's used to treat type 2 diabetes. So I think herbs are drugs. I'm certainly not going to test you on this, but please pause and have a look. These are a number of different herbal products, what they have been commonly used for, and a question of whether or not they work. So if you kind of take a quick look at the column under does it work, well, not a lot of them are known to work. Please be safe. So here's what I hear about myself, and I imagine it's come through a bit as I've made these videos for you, that I should be more open-minded, that I shouldn't be so close-minded. But you see, there's a danger to having an open mind, and that's that your brains can fall out. So remember, the Skeptic says, roosters don't make the sun come up, never believe one study, and find out who disagrees with you and why. Dr. Bosell from Snake Oil Science recommends if you're going to participate in alternative practices, please do your research. Find someone you like, because that relationship is extremely important. Make sure you believe in the practice, because that's what a lot of the results are based on. And do your research, science-based research. As for me, well, I won't prescribe placebos, and I wouldn't recommend complementary and alternative medicine. But if you're using it or want to try it, please know that it isn't supported by science. If it works, it's likely due to placebo, to that regression towards the mean. And hopefully it's safe and you're not going to be harmed. And if you want to disregard the lack of evidence and you want to try it because you believe it might work and hope for a placebo effect, go ahead. Please do. But don't discontinue your current treatment, because it's essential to your health. And if you're seeing me as a dietitian, please follow up with me, and please follow up with your doctors. Oh, last but not least, folks, stop and watch Tim Minchin and Storm. Thank you.